Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back, and there's some interesting news about your health. There's a study actually published in a variety of journals. One was in the Wall Street Journal that looked at low-salt diets. And a lot of people are taking excessive things or doing excessive things thinking it's going to profoundly change their life. Well, it might profoundly change your life, but not in the way you want. This study looked at low-salt diets. Well, most people never thought that low-salt diets could hurt you. Did you think a low-salt diet could hurt you? A lot of people don't think that taking vitamins and antioxidants can hurt you, and yet the studies show that they do. So this is an article that was published by Ron Winslow in the Wall Street Journal, and it took a study that was published in the New England Journal of Medicine. So New England Journal of Medicine is probably the most prestigious medical journal, and this looked at what happens when you reduce salt intake in your diet. So current guidelines from the U.S. government, the World Health Organization, the American Heart Association sets sodium targets at 1,500 to 2,300 milligrams or lower. That's below the U.S. average daily consumption of sodium of 3,400 milligrams. So this new study tracked 100,000 people from 17 studies over 3 years that consumed less than 3,000 milligrams of sodium a day. And what happened? They had a 27% higher rate of death or serious events such as heart attack or stroke in that period compared to people who had a salt intake of 3,000 to 6,000 milligrams. Wow! So again, for people who reduce their salt intake, our normal salt intake is about 3,000 to 6,000 milligrams a day of sodium. For people that consume less than 3,000 milligrams, the death rate or serious events such as heart attack or stroke increased 27%. So this will certainly challenge what exactly the recommendations are and how your diet can profoundly and possibly adversely affect your health. If you have other questions, you can call us during the week at 212-CHOICES or look it up yourself. It's in New England Journal of Medicine this past week. And here's another interesting study that was published. What are the differences in costs? Now, we often talk about one man who went to a big cancer hospital and had prostate brachytherapy, and it cost him $70,000. The same day a patient came to us, the same day it was less than $5,000, about 90% less. There he waited all day to get in the operating room. Here he's scheduled at 7 o'clock. He got in at 7 and was home by 9:30. But this study, which was from the University of California, was published by Lena Sun and looked at, from the Washington Post, what are the differences in costs of blood tests. So a group from University of California, San Francisco, looked at prices in California hospitals at 160 to 180 hospitals, so a lot of hospitals, and they found, for example, you can get basic metabolic tests like sodium, potassium, sugar. One hospital charged $35. One hospital charged $7,300 for a lipid profile. One hospital charged $10. Another hospital charged $10,000 for protein. One hospital charged $10. One charged $628. This was published in British Medical Journal. Now, you think the test that was $10,000 was better than the test that was done at $10? No. It's not in a machine. It's probably the exact same machine. Hospitals can charge what they want. You can pay what you want, or you can ask in advance. You may want to come to a place like us, And last month in AAPR magazine, they said if you have radiology needs, you should go to a private center rather than a hospital. The cost will be less than half. And I can confirm that if you go to a low-cost place like us, yes, you're not paying for the ivory tower, and you're not paying for the president of the hospital to get $4 million, but you have personal care with board-certified doctor in a private center that is not run by the drug companies and by surgeons. It's run for you, and it can make a heck of a lot of difference. So watch out. You don't know if you're going to get a blood test for $10 or $10,000 when you walk in the hospital. You may want to ask before you go in. And we had another interesting man who was at a big hospital. This is a financial man, 69 years old, divorced with 2 kids. He had melanoma on his cheek in 2002, was treated by surgery. And then in 2006, it was found to be recurrent to the mediastinum. The mediastinum is the center of the chest between the 2 lungs where the heart sits and where the major blood vessels are and the airway. Well, his cancer was there. He started with melanoma. It was biopsy proven. He started on interleukin, which he couldn't take. He went into kidney failure. His creatinine went up to 4. Normally it's about 1. He then started on immunotherapy for the last 5 years, and his doctors at this big cancer place kept on telling him it's stable, everything is good, it's stable. And then finally, recently, someone told him the cancer grew. And his friend, who's a urologist, who I know, his urology friend, sent him to us for a second opinion. And we got all the measurements of the cancer for these last 5-6 years. And in fact, it was never stable. It has been growing all along. In 2008, it was 5.6 centimeters. In 2011, it was 8.3 centimeters. In 2013, it was 9 centimeters. Now it's 13 centimeters in maximum diameter. Now, a big man's fist, my fist is about 9 centimeters. So his is 13 centimeter maximum diameter. The whole cancer is 1 liter, 1,000 cc's. So he's been on immunotherapy for 5 years. It hasn't worked. I don't think it ever worked. Put him in kidney failure. His kidneys never got back to normal. He was thinking it's working, but it wasn't. Was he angry? I think he's angry. I'm upset that someone would tell him the treatment's working when it's not working, because he could have been informed well before that it's not working. Luckily, he has a friend urologist with whom I work, and the urologist said, why don't you go to Lederman for a second opinion? And that's what happened. He went to Lederman for a second opinion. We have another patient who came in with a Gleason 7 PSA 11. He actually had a PSA 11. He came in to us a few weeks ago, got a biopsy, has history of congestive heart failure and high blood pressure. He catheterizes himself. He cannot urinate normally. So he's a man whose bladder doesn't work, and now he has a prostate cancer, and he'd be considered high risk because his PSA is more than 10, his Gleason's more than 6. He saw the data, and I'm happy to give you the data or show you the data. You can see our data versus other centers across America, proton beam, external beam, surgery, versus us. Our premier program is prostate brachytherapy and 25 treatments in the stereotactic frame, all outpatient therapy, all in our center at 38th and Broadway, and you'll see the benefits of coming possibly to us. So if you have questions, please feel free to call. Medical questions, please call us at 212-CHOICES anytime you wish. We'll be happy to answer your medical questions. It's best really to come in. If you want the booklet, you can call us at the same number, 212-CHOICES. We're going to have another show on WOR tonight at 9 p.m., and we hope that you have a chance to tune in. I hope you have a great, fantastic day, and look at our information. Thank you for listening. God bless you, and have a healthy, safe weekend, week, and life.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
New York's new 710 WOR.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super. In Manhattan at 38th and Broadway. Custom tailored treatment to hit the cancer. Call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212-CHOICES. 12-CHOICES. 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 12-CHOICES.